For this occupational therapy portfolio topic, I'm going to be assessing my patient's vision using 4 different visual assessments. So first I'm going to start with by testing my patient's oculomotor, and for this I'm doing an assessment called the ball rotary movement. So I have my finger and I want you to follow my finger, and what I'm going to do is I'm going to move my finger in an arc all around their visual field, shoulder width apart, and then back to the center. So I want you to follow my finger, okay? Okay, so with this I am testing for, I want to watch and make sure that there is symmetry between the eyes, and I'm going to note if there's any deviation and whether it's lateral, medial, superior, or inferior. Next, I'll be testing my patient's ability to do pursuits through the smooth visual tracking assessment. So what I'm going to do is, again, I'm going to have my patient follow my finger with both eyes. And so I'll start here. Just go ahead and follow my finger. And with this assessment, what I was doing was I was making sure that her eyes were able to follow my finger in straight lines and an X pattern and an H pattern. Next, I'll be assessing my patient's ability for Saccades using the rapid alternation. So what I'm going to do is I'll have my finger and my pencil held up here. I have them about 6 to 8 inches apart, and I have them about 16 inches from her. So what I want you to do is look at my pencil, back at my finger, to my pencil, to my finger, and back and forth as quickly as you can. Okay, and now I'm going to do one that's up and down, again 6 to 8 inches apart. Look at my pencil, my finger, back of my pencil, my finger, back and forth as quickly as you can. Okay, and I'm looking to make sure that the eyes are symmetrical and able to track together, and I'm also looking for any nystagmus, which would be involuntary movement of the eye. Next, I'm going to be testing my patient's field of vision using the confrontation test. So there's a couple different ways to do this test, and I'll show you each one. So first I'm going to have my patient look at my nose, and then I'm going to have you cover your right eye, okay? And whichever eye I have them cover, I'm going to cover my opposite eye, because I want to be able to see in my visual field in comparison to what they're seeing in their visual field. So the first way that I can do this is, while you're looking at my nose, I'm going to bring my finger in from all 4 quadrants from the visual field, and let me know when you first see my finger, okay?
Okay. Yes. 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 Yes.
Okay, so that was one way to do it. And what I'm doing is, once I bring the finger to the middle of the visual field, I want to make sure to bring it back out in that quadrant as well. So another option is to say, let me know if you can't see my finger at any point during the movement, okay?
Okay.
Okay, so there my patient didn't say anything, leading me to believe that they were able to see my finger and that my finger didn't disappear randomly at any point throughout the visual field. So the next one I'm going to do is I'm going to hold up a different number of fingers in each of the 4 quadrants and have my patient tell me how many fingers I'm holding up. So again, go ahead and cover that right eye. Okay, I'm going to hold up fingers in each quadrant and let me know how many you see. Remember to keep looking at my nose.
2, 4, 5, 1.
Okay, so my patient was able to accurately say the number that I was holding up in each quadrant. So now that we have done the confrontation test on my patient's right eye, we would go ahead and make sure to test my patient's left eye as well. So I would have my patient cover their left eye, and with this test we want to make sure that our patient isn't covering their eye with their fingertips, as they could press on their eye and this could make a change in the assessment. They want to make sure to use the palm of their hand. So again, for the confrontation test, you're going to test both eyes, and all of the ways that I have shown you are ways to test my patient's field of vision.